Our next panel will be on the political opportunities and barriers to marijuana research. This will be moderated by Natalie Ginsburg. I'm going to introduce her now, and then she will introduce the rest of her panel. If you guys could please quiet your conversations now so we can give the presenters our respect. Thank you. Natalie Ginsburg is the MAPS Policy and Advocacy Manager. She holds a master's in social work from Columbia University, where she served as a policy fellow at the Drug Policy Alliance, helping legalize medical marijuana in her home state, New York. Natalie's interest in psychedelic-assisted therapy has been spurred by her clinical work with trauma survivors as a court-mediated therapist for individuals arrested for prostitution and drug-related offenses. Through her work at MAPS, Natalie advocates for research to provide evidence-based alternatives to both the war on drugs and the current mental health paradigm. Please give a warm welcome to our panel. Thank you.
Thank you. Hi. So today, over 80% of Americans support medical cannabis, including our president. And it's still more difficult to do research on cannabis than even MDMA. When I actually initially started working at MAPS, it was to focus on barriers to cannabis research, because despite the fact that we had been conducting MDMA research for over a decade, we were unable to start our study of cannabis despite receiving a $2.15 million grant from the state of Colorado to do that research. So today we have three great panelists to represent different perspectives on the barriers and opportunities in marijuana research. First, we have Michael Collins, who is the Deputy Director at Drug Policy Alliance's Office of National Affairs in Washington, D.C., where he works with Congress on a variety of drug policy issues, including marijuana reform, sentencing reform, and drug war spending. He is originally from Scotland and lived in France, Spain, and Mexico before moving to the U.S. Michael has discussed drug policy issues in the New York Times, the Washington Post, and on CNN and the BBC. Amanda Reiman was formerly the manager of marijuana law and policy at the Drug Policy Alliance. Amanda joined DPA in 2012 after working with Berkeley Patients Group, a renowned medical marijuana dispensary, as Director of Research and Patient Service. Amanda currently serves on the Cannabis Regulatory Commission for the City of Oakland and has consulted with various cities, states, and nations on the development of medical marijuana policy. And Amanda is currently the head of community relations at Flocana. Nazlee Maghsoudi is the Knowledge Translation Manager at the International Center for Science and Drug Policy, where she plays a lead role in the production and dissemination of evidence-based drug policy research. She is strategic advisor at Canadian Students for Sensible Drug Policy, CSSDP, having formerly acted as chair of the board of directors. Nazlee is also an outreach volunteer at TRIP Project, a harm reduction program in Toronto that provides education and support to youth in nightlife and party settings. Happy to have you all here. Michael, I'm going to ask the panelists to present for a few minutes on their different areas of expertise, and then we will turn it over to the audience to ask questions. Michael, please take it away.
I'm really happy to be here. I didn't bring along a PowerPoint presentation, so you're going to have to listen to my beautiful Scottish accent for the whole time that I talk. I'm going to talk a little bit about some of the recent history on marijuana policy as far as the federal, national level goes. Speak a little bit about some of the current trends and developments, and then what the future holds. So, under the Obama administration, I think I would sort of characterize it as, the sort of the Joni Mitchell song, "You don't know what you've got till it's gone," because I think there was a lot of challenging circumstances with the Obama administration, but we certainly made a lot of progress in the area of marijuana. A lot of that was not necessarily because of President Obama, but it wasn't really in spite of him either. I would say that Obama himself was not really interested in marijuana policy. You saw that sort of during the rescheduling debate last year. They had sort of quite a hands-off approach to marijuana policy. But as I said, progress was made. We had the Cole memo, which said that the Obama administration's Department of Justice would not intervene in states that had legalized marijuana. We had the elimination of certain research barriers, the PHS service review, and the NIDA monopoly, which was discussed in the previous panel. And also just congressionally, we made a lot of progress with passing various different pieces of legislation, such as the Rohrabacher-Farr Amendment, which meant that the Department of Justice would not go after medical marijuana dispensaries, and we saw the introduction of legislation in the Senate on marijuana for the first time. So a lot of progress was made under Obama, but as I said, we could have done a lot more. But now, given the current circumstances, we're sort of looking back and we had a good thing going. A lot of the challenges that we currently face are, like, in terms of Capitol Hill, in terms of research, the barriers are not well understood. I think some of the issues, the NIDA monopoly and scheduling, are somewhat esoteric and difficult for members of Congress and their staff to understand. They don't always have the longest attention span. And so, it's difficult. We've had a lot of confusion, for example, over the issue of scheduling. Some people thinking that moving from Schedule 1 to Schedule 2 means legalization. Some people thinking that marijuana businesses are going to get shut down if we reschedule marijuana. So a lot of confusion there. Another trend which we've seen that is somewhat disappointing is the opposition to marijuana reform is sort of changing their arguments a little bit and now using the research argument to kind of bolster their side, sort of saying that we need more research and we need to research marijuana more as a way of sort of slowing down marijuana reform. And that's somewhat challenging because obviously Drug Policy Alliance supports research, but we also support moving forward with reform, while we do research. There's a lot of interesting developments in the area of sort of the opioid crisis in marijuana, and marijuana as a substitute for opioids, I think Amanda might touch on. The issue of CBD and the emergence of CBD over the past couple of years has been somewhat sort of double-edged sword. On the one hand, you have a lot of Republicans in red states that are now sort of like looking at medical marijuana differently, but on the other side, it's sort of challenging because sometimes they just stop at CBD, and that's limiting in terms of the debate around medical marijuana. The big challenge, as I'm sure most of you are aware, is a guy called Jeff Sessions, who's now you may have heard of him. He's the Attorney General. Boo, Jeff Sessions. He's the new Attorney General, and really was probably, in terms of marijuana policy, the worst guy on the planet you could have picked to be worse than Chris Christie, to be the Attorney General. Has very regressive views on marijuana. It's not really clear what he's going to do in terms of marijuana. He has a lot of power and the ability to, slow down research, the ability to go after sort of state legal marijuana programs. It seems like he will do something, but there's a whole variety of options that he has, unfortunately, and we're just sort of waiting and seeing just now. But, to end on a positive note, I think we're in a good space as far as Congress. There's a lot of support among Democrats and Republicans for marijuana reform. My sense is if we put a piece of legislation on the floor ending prohibition of medical marijuana, it would pass. Recreational marijuana would be close, but could also pass. And so we're going to continue to make progress in Congress and really use Congress as a way of pushing back against the terrible things that the Trump administration might do in marijuana policy.
Thank you.
It's depressing, but it was informative. Hi, I'm Amanda Reiman. Thank you for coming to this session. I thought maybe it would be helpful for me to just talk a bit about my own path as a researcher and some of the barriers I've come across in the past 15 years that I've been doing research on medical cannabis. I started doing my first study back in 2004, and it was my doctoral dissertation. And I was getting my PhD in social welfare at Berkeley. I was a medical cannabis patient, and I was noticing when I went to dispensaries that they were really providing a lot more than just cannabis to their patients. They were providing social support, they were providing access to holistic health services, to things like free food, internet access, and I really wanted to study that as a social worker. I thought it was very fascinating, especially because they were providing all these services for free. To people who didn't have insurance. And I knew from my work in social services that the idea of somebody without insurance being able to go get free acupuncture was like unheard of. And yet this is what dispensaries were providing to people. So, I figured as a doctoral dissertation, it was something you could actually do for research. It was the first time UC Berkeley had ever had a human subjects proposal to study medical cannabis. They brought in a consultant, and they approved it. And I was really surprised and happy that they seemed to be supporting this method of research. So I did my doctoral dissertation, and I was also funded by a pre-doctoral fellowship from the federal government. So the federal government actually funded my doctoral dissertation on medical cannabis dispensaries. They will deny that. They do not like the fact that they did that, and I don't think they really knew that they were doing that because I was part of a pre-doctoral training program at the Alcohol Research Group, which is funded by NIAAA. So I did my research there, and then the next year I continued on with a postdoctoral fellowship at Alcohol Research Group after I got my PhD, and I was going around and presenting my doctoral research, as people do after they finish their dissertation. And I got invited by Americans for Safe Access to come down to a governor's meeting in San Diego. And they were going to do a press conference, and this was probably 2007, 10 years ago. So I came down, and they had this press conference, and I said, well, this is the results of my research, and we find that dispensaries are offering things to patients that are good for people's health and are good for community health. And I came home, and the headline in the San Diego paper the next day was, "Medical Cannabis Dispensaries Good for Communities, Federal Researcher Says." They were not happy about that headline, and my mentor at Alcohol Research Group, an amazing scientist named Lee Kaskudis, received a call from the feds. And they said, excuse me, you have someone who's being funded by the federal government out there talking positively about cannabis, and this can just not be. And, thankfully for her, she said, well, that's her research. Those are her results. I'm not going to ask her to lie about her results just because they don't fit in with the paradigm that you've decided we all have to have around drugs. And I was very thankful for that because she stood up for me and she stood up for that research. Then she called me into her office and she said, all right, Amanda, you're going to have to make a decision. You're either going to have to study the things they want to be studied, which is pretty much adolescent substance use and hazardous marijuana use, or you're going to have to go out on your own. Because at this point, there just isn't federal funding for the kind of research that you want to do. So I decided to take one more shot. I submitted an R21, which is a smallish grant, to NIDA to do a national cannabis survey. I figured at least maybe they'd want to know more than just have you used marijuana in the past 6 months, which is basically what our national household survey asks. So I got a really good team together. I mean, conservative people, like folks that had already done a lot of work for NIDA, and we submitted this grant. And it got scored. It did not get funded. And the comments were from two completely opposite camps. They were either, oh my gosh, we have to do this. Why aren't we doing this research? This is information we really need. Or it was, are you kidding me? Have you seen this girl's CV? She is a legalizer. This is just a way for us to get cannabis legal. Screw her, basically. So it didn't get funded, and I left Alcohol Research Group, and I went to Berkeley Patients Group, which was a very large dispensary in Berkeley that saw thousands of patients a day. And I said, you know what? If the federal government isn't interested in finding out this information, I'm going to find it out for myself. So I asked BPG to hire me as their director of research. There weren't directors of research at dispensaries, but I said, look, you have patients, I have surveys, let's get together. So they hired me in 2009, and I did a study there of cannabis as a substitute for alcohol and other drugs that was published in the Harm Reduction Journal. Then Melinda Haig came and shut us down, the U.S. Attorney, and I had to leave that position. And that's when I went to Drug Policy Alliance in 2012, because I figured that I was kind of butting my head against a wall with the research, and so maybe we needed to start changing some policies, because that would open up the research. So I went and tried to do that, and we were fairly successful. We legalized marijuana in California, which was awesome. And so what that did is it really did open up the research, because what we see now is that in the state of California, not only because of our legalization are we going to have millions of dollars going into research, not just at UCS or at UCSD at Igor Grant's Center for Medical Cannabis Research, but for any UC or Cal State that wants to apply for the millions of dollars that will be available for research purposes in California. And there is a bill going through the legislature that would say that California's university system would apply to NIDA to become a receiver and participant in growing cannabis for research purposes alongside the University of Mississippi. Now that NIDA has said they're lifting the monopoly, the UC system is ready to take that on. I'm thinking UC Davis would be an amazing place to cultivate cannabis for research purposes. So, that's kind of where my path has taken me. I'm now reinstating my affiliate scientist relationship with Alcohol Research Group because it's been 10 years later and the field is opening up. I'm working with High Sobriety, which is a treatment center in LA that's using cannabis as a medication-assisted treatment, similar to methadone for people who are getting off opiates and alcohol. Kaiser's interested in studying it. UCLA is interested in studying it. So I think we've turned a corner. And the last thing I want to say is that we never, ever, ever would have turned this corner if it had not been for MAPS and for the work of Rick and for the work of Sue Sisley. And, the years and years and years, and Lyle Craker and the folks that challenged the DEA and all of their craziness around having to build a nuclear bunker to store cannabis for research purposes. And so, it's a marathon. It's not a sprint. And, we're going to be working on this for a long time. But thank you so much to the folks that have really stuck with it because it is thankless. But we would not be where we are today without it. So that's been my journey, and I thank you all for listening.
Thank you.
Okay. Good morning, everyone. Thank you so much for being here, and thank you for inviting me to be on this panel. It's such an honor to be next to you both. So I'm going to switch gears a little bit and aim to bring an international dimension to this panel. I'm going to speak first about the international context related to the scheduling of cannabis, particularly at the United Nations level, and then about research in Canada as we move towards cannabis legalization and change our policies nationally. So starting off, many of you will know that the World Health Organization is the leading health body internationally that guides governments on issues of health policy and best practices in health. So they actually have an expert committee on drug dependence, the ECDD, or the committee, that is mandated by 2 drug control conventions. And it's worth noting that there are 3 international drug control conventions that are essentially signed up to by all states around the world and therefore are very influential. 2 of those treaties mandate this committee to undertake scientific review and recommend to countries around the world how different substances should be scheduled. And that is meant to be based on up-to-date evidence about the therapeutic value of the substances, as well as the risks related to non-medical use, so the potential for abuse, as they refer to it. Now, many of you may be interested to know that historically, cannabis was last reviewed actually in 1935, so 82 years ago was the last time the WHO reviewed cannabis. And it was actually not even the WHO and the UN then, it was under the predecessor, the League of Nations, so it was a very long time ago. And this review, much like the scheduling that happened in national governments around the world at that time, was really based on morality, on racial issues, on cultural stereotypes. It was not based on evidence whatsoever. Yet the classification of cannabis remains at the international level in Schedule I and Schedule IV of the 1961 Single Convention, which essentially means that it is rated as being just as addictive of substances like heroin, and it is rated as having no therapeutic or medicinal value whatsoever. So this is, because they haven't done a review, this is implicitly the position of the WHO currently as it stands. Now, we have some positive progress in this regard, as based on the growth of medical use that has been happening internationally, in November 2016, this committee indicated that they were going to proceed with a pre-review of cannabis. Now, this pre-review is meant to be done before May of 2018, and it's meant to look at all the evidence that exists to determine whether there is some justification for reconsidering the scheduling of cannabis at the international level. If they find that there is evidence to justify that, then they would recommend a critical review. So there's many steps that are left, so that would lead to a critical review. And then after conducting a critical review, they could recommend to the member states at the international level that cannabis be rescheduled. So that is very possible that could happen. Everyone here will be well aware of the therapeutic value of cannabis. So a realistic look at the evidence should realistically lead to recommendations for rescheduling. And that is something that could happen. They could come to that conclusion after conducting a critical review. But even if that was to occur, the reality is that member states at the UN level do not need to accept the WHO's recommendation. They can simply vote by majority of the 53 member states that compose what's called the Commission of Narcotic Drugs, the UN's main policy-making body on drugs. They could simply vote to reject the WHO's recommendation and proceed with the schedules as they currently are. That's probably not so far-fetched. For those that are familiar with the international level, there is a lot of disagreement with how global drug policy should look. Increasing divergence between approaches being taken in countries like the Philippines, which are using the death penalty, which are essentially doing extrajudicial killings just through their entire country. And then you have countries like Canada, which I'll talk about, that are moving forward cannabis legalization. So there's really a divergent views, and it's very likely that if the WHO were to recommend that cannabis be rescheduled, those prohibitionist voices would vote against that and therefore not allow it to proceed. And in fact, it's worth noting that dronabinol, which many of you will know is one of the main constituents of cannabis, was rejected by the CND when the WHO recommended that it be rescheduled in 2006. So that is perhaps a little bit concerning in terms of how that could play out again if it came to cannabis. But we do have some promising national governments moving forward, like Canada, that could perhaps create some space at the international level for that type of movement and support that type of movement. So that's the international context. Switching over to Canada for a moment, many of you will be aware that on April 13th, so just really recently, the Canadian government introduced legislation to regulate and legalize non-medical cannabis markets, so recreational cannabis markets. So it's a very exciting time in Canada. And what we did see is that legislation actually is leaving a lot up to our provinces and territories. So we have 13 provinces and territories in Canada, and they typically have jurisdiction over health issues and also over alcohol and tobacco. So unsurprisingly, this legislation is giving them a lot of leeway, particularly over retail and distribution models, as well as other issues like the age restrictions, for example, although it can't be any lower than 18, which is what has been mandated at the federal level. But really what this means is that we could have, realistically, 13 different provincial and territorial level experiments on models for cannabis regulation. Some provinces are considering selling it alongside alcohol, for example. Others are considering the dispensary model. Some are considering mail order only. So with that in mind, I think this makes it really, really important to be conducting research, measuring data, and monitoring the impacts that we see across these different provinces in order to make sure that we are facilitating the best outcomes and finding the best practices and then improving and tweaking our policies at those provincial levels to actually foster the outcomes that we want to see. Now, the Government of Canada has indicated that an element of the new regime will be conducting baseline data and ongoing research and surveillance, but unfortunately, the new legislation didn't include anything about that. It's still promising that it will come. It's just the first of many bills that will be released on this issue. And actually, a report that came out from Public Safety Canada outlined 45 classes of metrics that should be evaluated when we're looking at cannabis policy regimes. And those were across the issues of public safety, public health, economics, and children and youth. Actually, a lot of the metrics that they indicated were ones that are already being evaluated in the United States in places that have moved forward with cannabis legalization and regulation. And DPA actually produces a really great report. The most recent one came out in December last year, where they look at the different impacts across different states that have legalized cannabis. So some of the metrics that they use, for example, are tax revenues and use among youth. And those are things that Canada has also indicated that they would be measuring. I think what's really important is that the surveillance is not only crucial for modifying our responses at our provincial levels and making the best policies that we can, but also in terms of supporting the continuous move away from prohibition. A lot of states are going to be watching Canada really closely as we move forward with cannabis legalization and regulation. So it is crucial to collect evidence on the impacts in order to inform and reform cannabis policies in jurisdictions around the world. The last comment I just wanted to make before wrapping up is that I think it's really important not to limit cannabis policy evaluation just to what seems to be direct cannabis-related outcomes, because that ignores the reality of the drug market. So we know that the drug market is highly interconnected, and changes in one area of the drug market undoubtedly impact other areas. So we need to be considering other metrics and indicators that don't seem so directly linked, but inevitably are. Amanda made a really great presentation yesterday that some of you may have been at that talked about the connections between opioid use and cannabis use and that substitution effect. So for example, monitoring things like the use of opioids, dependence on opioids, and even overdose rates are indicators that would be particularly relevant as we evaluate our cannabis policies at the national level. And I would encourage our government to continue to include those things as we move forward. So that's all I have. Thank you, and look forward to your questions and comments.
Thank you. Thank you all so much. I think
So unfortunately, we are out of time right now, but we are in a 30-minute break right now. So if you'd like to stay and ask questions, you're welcome to do that. Thank you all.
yeah, so we'll stay for some questions. Thanks. You guys are awesome.
So shall we ask here or up front?
Yeah, you can ask there.
Oh, okay.
Sure, go ahead.
So I was just wondering if there's a general leaning towards preference towards legalization of marijuana versus medical marijuana. And my tendency would be to favor legalization, but then there's some concerns towards the potential marketing to youth and also trying to optimize the rewarding aspects of marijuana when producing it. So what are the feelings up in the panel?
So, do you say of medical versus adult use?
Legalization for recreational versus medical marijuana, medicalization.
There's a lot of different ideas about, some folks say, oh, all use is medical. I mean, I think that all use has the potential to be therapeutic, and that there's different types of therapy that people seek from cannabis. And so when I talk about adult use versus medical, in my mind, what I'm really talking about is prescription versus over-the-counter use. So, some use is where you're trying to actually impact a disease state, where you're talking to a doctor, where you're looking very closely at the impact of it on you physically compared to the disease that you have. And then there's folks who maybe you're using it more palliatively as a substitute for Tylenol, ibuprofen, other types of over-the-counter medications. And I think when we talk about adult use, what we're really talking about is opening that up to an over-the-counter situation with the knowledge that cannabis is safe enough for adults to make the decision about whether they want to use it, and that the doctor doesn't need to be a part of that decision unless it's really for a strict medical purpose. When we were running Prop 64 in California, the California Medical Association endorsed legalization, and one of the reasons was because they were tired of being gatekeepers for adults who wanted to use cannabis. And they said, look, if you have a serious illness and you want to try to use cannabis as a medicine, come talk to me. If you feel like you're using cannabis in a harmful way, come talk to me. Otherwise, I don't really see that I need to be a part of this. And so I think it's more over-the-counter versus prescription than medicine versus recreation.
Yeah, and, Drug Policy Alliance supports legalizing marijuana for adult use as well as medical marijuana, and the reason is not necessarily because we think that everybody should be using marijuana. It's more that we have seen firsthand the devastating impact of the criminalization of marijuana, most importantly on people of color. I mean, just last week, the head of the Department of Homeland Security said that he would be using marijuana possession as a reason to deport people, even people who are here legally, non-citizens, people who are here, without the right documents. And so that sort of brings home really the sort of failure and the dangers of marijuana prohibition writ large. That, medical marijuana is obviously very important, but I think we really need to reform our marijuana laws writ large at the federal level to do away with a lot of those negative impacts.
Hi. Well, the question is in the same direction because I'm from Brazil. So we have a lot of discussion about prohibitionism and drug legalization. And one thing that is happening is that the medical discourse is like taking over. So, for example, cannabinoid was kind of legalized by the health agency, but there is no talking about regulation or legalization of cannabis growth or use. And now medical corporations are like producing cannabis, so to sell it like a medicine to the population. And I was thinking, what are your thoughts of the risks of like this medicalization discourse in countries such as Latin American, African countries, because there is the risk of being another colonization policy of medical corporations, international corporations, acting like in countries like Brazil in the order of legalization drugs, but not on the social reform side, the medicalization side. Thank you.
I mean, I appreciate that concern. I can't speak specifically about Brazil, but the US experience, I believe, is that medical marijuana, which is now legal in like 29 states, West Virginia being the latest one. Yay. The reality is that has got the public and politicians sort of accustomed to marijuana, and they see that, the sky hasn't fallen and all the sort of terrible things we were told about, reforming marijuana laws hasn't happened, and there are a lot of benefits to marijuana medicinally, and that has, if you look at, again, very specifically the US experience, all the states that legalized marijuana, the 8 states that legalized marijuana, I believe all of them had medical marijuana laws before, and in fact, states that have tried to legalize marijuana without, tackling the medical issue first, like Ohio, for example. I'm not saying that's why they failed, but I think part of the reason was like the public were not familiar with, marijuana being sold in dispensaries, and I think it's very helpful that medical marijuana is so widespread, and it has sort of opened up larger debate on marijuana reform, and I hope that would be the case in other countries as well.
I do think, though, for agricultural countries, there's an opportunity there that we can't pass by that is at risk from strict medicalization, which is the ability of people who are farming to use cannabis and hemp to help subsidize diversification of farms. And, I work with an organization called the International Cannabis Farmers Association, and one of our goals is to promote traditional farming as a method of producing cannabis, and to really empower rural communities to embrace outdoor cultivation as an agricultural farming component. And so I think in Latin America especially, there's a lot of opportunity for that. And so I would like to see those programs coexist. I would like to see people that feel more comfortable going to the pharmacy to obtain a product that comes in a sealed package, that they can do that, but people that feel more comfortable going to their local community farm and obtaining their medicine that way have that ability to do it as well. So I think it's important to advocate that you don't, kill one to promote the other.
All right, well, if there are no more questions, I guess that's it. Thank you all again.